Welcome dear students. I, Assistant Professor Varsha Tambe from Kekewa College of Pharmacy, Nasi. Today we are going to learn about sociology and health. Let's see some definitions. Society. What is meant by society? It is a system of interrelationships of man in his group. Maybe country, village, school or factory, etc. So, the collection of the things which are uh, in relationship with the man is called as society. Next is social science. Social science deals with man's behavior in his society, including history, geography, civics, and politics. Third definition is medical sociology. It deals with the relationship between health and social factors such as environmental conditions surrounding man and affects his health, traditions, lifestyles, behaviors, self-treatment, values, customs and cultures. Medical sociology is concerned with the distribution of healthcare services and in particular the inequalities in healthcare. Next definition is what is social security or social insurance. So security given to man by social, governmental or private organizations for risks he is exposed as a sickness, loss of work, violence, death, accidents, fire and disability. In such conditions, the security is given to the men is generally considered as a social security or social insurance. Next is social defense. For protection against antisocial criminal behaviors of man as beggary, prostitution, alcoholism, social systems that defends the society against crime by treating and defending the offended. Next definition is social disease. So diseases that have social stigma and human interactions as TB, AIDS and leprosy. Generally the communicable diseases are considered as a social disease. Social problems like poverty, crime, starvation, alcoholism, STD, addiction, street children, lonely elderly, discriminations, such are the social problems. Social factors affecting health and disease. Levels of socio-economic standard determine health status of individuals as per capita income, family size, literacy, poverty, malnutrition, unemployment. Such are the social factors which generally affects health and may generate diseases in the human beings. Okay, so let's elaborate the term medical sociology. So it comprises different elements including social epidemiology. What is social epidemiology? The study of socio-economic, demographic and behavioral factors in relation to the causes of disease and mortality diagnosis, developed and organizational dynamics of occupations and professions in healthcare services, hospitals, health maintenance and long-term care organizations. Social epidemiology includes inter-organizational relationships between patient and physicians. The reactions of societies to illness, including cultural meanings and normative expectations. The social policies, social movements, and economic conditions that shape and are shaped by health and disease within countries as well as in a comparative international context. The social patterns of the utilization of health services, the relationship of healthcare delivery system to other social institutions and social policies towards health. Okay, so what are the main topics in medical sociology? Social causes of disease and illness is one of the topic. Then reasons for seeking particular types of medical service, compliance or non-compliance with medical advice, health services for vulnerable groups. Health services for vulnerable groups. Vulnerable groups means what? The groups which are more susceptible for the disease. Importance of medical sociology. Social behavior plays a critical role in determining or and influencing the health of individuals, groups and the larger society. The most important thing for all specialties in medicine is the diagnosis of disease in patients, but studying the underlying cause of disease, spread cultural effects, the ability to control among all family members and friends, neighborhood family diagnosis is also important for control that disease in the community. Many facts relating social conditions to diseases as low social classes had higher morbidities and mortalities than higher classes. The spread of diseases is heavily influenced by the socio-economic status of individuals, ethnic traditions or beliefs, cultural factors and types of nutrition. More than one individual in the same family are affected by the disease. Next point is data needed for social medicine and research. Socio-economic or demographic data such as age, family size, education, occupation, habits, income, residence, position in siblings, etc. Such data is needed for social medicine and disease. Conditions for conditions of house. Available facilities in the house are also a part of research. Nutritional status, breastfeeding, types of food they are eating, food habits of the family members, then marital status, whether the persons are divorced or death of parents is there, satisfaction with available services, then attendance, immunization coverage. Next point is prevailing health services. Last is political, legal, religious aspects affecting the health. So what is role of medical services in society? Health promotion of all people, lifestyle modification, health education, then cooperation with other sectors affecting health, change, change policies, put legislations, research studies to improve health, prevent diseases, helps handicaps. The next role of medical service is diagnosis and treatment of disease, prevent spread to others, acceptable qualified health services should be provided. Health impact assessment of all projects, sharing in local community in planning or in solving social problems related to health. Next role is counseling, share in controlling disasters, community participation, mobilization, increasing advocacy, assessment of QOL, quantity pensions for disabled. Next point is family as a social unit. If we consider society, primary unit of society is family. It consists of group of biologically related individuals living together and eat from the same kitchen. That is, household may include servants. Family members share common genes, physical, social, cultural and environmental conditions. Family circle. Formation by marriage. Extension of family is by birth of first child. Complete extension is at birth of last child. Contraction. First child leave home or death of members. Complete contraction is last child leave or death of parents. Not all family cycles are the same. Types of families. Nuclear family, that is married couples and their dependent children. Joint family. Extended includes married couples and their children. In rural areas, usually men are related by blood. All properties in house belongs to all. Senior man has the authority. They give strength to each other. Continue family name. Three generation family in which children, parents and grandparents lives together. Broken family means divorced, died or separated human beings. Functions of family. Resistance, to offer clean, comfortable place. Distribution of functions. Reproduction, child rearing. Socialization of children before school. Economic support. Health care of each other. Social support during labor, stress, insults. Care of elderly, handicapped. Family act as a placenta, feeding its members with filtered beneficial habits required to be physically, socially and mentally healthy. Cultural factors in family affecting health. Concept of disease, etiology, treatment like evil eyes, God's will, past mistakes, spirit or ghost, use of folk remedies and plants. Unsanitary disposal of sewage, refuse in street, public places, in water, animal breeding inside houses. Okay. Next is food habits. Vegetarians, fasting, certain types of cooking, utensils, additives, foodstuffs, male eats more and first. Next is child labor, which is also affecting the health of the family. Next is person's hygiene, no bath, oral or teeth hygiene, then shared shavings, circumcision, drinking from same cup, cutting nails, wearing shoes, smoking shisha. Early marriages, birth is also an cultural factor which cultural factor in family which affecting the health. Okay, next point is effects of urbanization on health and disease. So in recent years urbanization is takes place, okay, and is growing day by day. So what is the effect of urbanization on health, and is there any role of is there any role of urbanization in generating diseases that we are going to see. First is urban. So the word urban means fashionable living, wide acquaintance with things and people and political manner of speech. Urban area with a high density of population. In the context of India, it is defined as all places with a municipality, corporation, cantonment board or notified town area committee, etc., known as statutory town. All other places which satisfy the following criteria are also known as census town. Okay, so a minimum population of 5,000 can be considered as a town. At least 75% of the main workers engaged in non-agriculture pursuits, and a density of population of at least 400 per square kilometer. Urbanization. Urbanization involves a physical change in which increasing proportions of populations live in urban settings. The movement of people to cities is one of the dominant characteristics of population change of 21st centuries. Growing urbanization is a recent phenomenon in developing countries. In India, the level of urbanization increased from 27.81% in 2001 census to 31.16% in 2011 census. The urban population in India is 377.1 million in 2011 with increase of 91 million from 2001 census. Urbanization, a constant growing phenomenon of increasing population living in cities, found to be more in low income countries. Urbanization factors affecting health and disease. First is substandard housing and overcrowding. Due to overcrowding, the housing conditions are very poor. Overcrowding refers where more people are living within a single dwelling where movement is restricted, privacy is skeluted, hygiene is impossible, rest and sleep is difficult. In general, overcrowding will lead to rapid spread of infectious diseases, especially infections such as TB, influenza, diphtheria. Second is inadequate sewage and garbage disposal. It leads to fly nuisance. Contaminated water. So waterborne diseases are common like diarrhea, typhoid, cholera, etc. Vectin-borne diseases. This is found to be more common in poor people living in urban area. Example is malaria, filariasis, plague, dengue, scabies, etc. Fifth is air population. 1.3 billion urban residents worldwide are exposed to air population level above recommended limit. The effects are immediate and delayed. First is immediate effect. It may causes acute bronchitis, and delayed effects in that chronic bronchitis, lung cancer, bronchial asthma, emphysema and respiratory allergy may occur. Sixth is motor vehicle accidents. It is more common among all fatal accidents found in urban areas. Industrial accidents are also occur with increasing frequency because of untrained workers from the urban set. Psychosomatic disorders due to poverty and unemployment, stress associated disorders are more common among the urban people residing in shanty towns. Duodenal ulcer, bronchial asthma, hypertension, coronary heart disease, mental disorders, social deviant behavior, that is suicide, crime, violence and drug abuse is there. Next point is poverty and health. What is relationship of poverty with the health that we are going to discuss. So it is a state of poor economical status opposed to richness is called as poverty. The poor are those who are below poverty line, that is BPL. Poverty impairs progress all factors of human life, that is housing, sanitization, getting health care services, dietary intake, etc., resulting in increased in morbidity and mortality. Okay, so what are the causes of poverty? Rapid population growth among the poor, low rate of economic development, unemployment, growth strategy, inequalities of income, little trickle down effect of economic development, backwardness of agriculture, inadequate anti-poverty measures, low education, inflationary rise in price, socio-cultural factors, political factors. These factors are responsible to cause poverty. How to measure the socio-economic status? Based on three variables, that is education, occupation and income. And second method is based on three methods in which B.G. Prasad's method is there, Kuppuswamy method is there, and Parikh's method is there. Okay, so what is meant by below poverty line? That is BPL. It is defined as a cutoff line of per capita monthly income below which it is not possible to purchase food as to obtain minimum desirable limit of energy. That is 2400 calorie per person per day in rural areas and 2100 kilocalorie in urban areas. They fall below class 5th according to P.G. Prasad's method. Poverty also associated with social factors, that is illiteracy, ignorance, lack of knowledge, poor living conditions, overcrowding, and blind beliefs and taboos. So poverty and sickness are interrelated, as you can see in this slide. So what are the health hazards of poverty? First is communicable diseases may occur, in that waterborne disease, foodborne disease, respiratory diseases, STIs including HIV. Non-communicable disease, in which malnutrition, anemia, vitamin and mineral deficiency. Social problems may arise due to poverty, in that prostitution, drug addiction, alcoholism, family disintegration, antisocial behavior like beggary, violence, delinquency, terrorism. Mental problems, in that depression, loneliness, inferiority complex, suicidal tendency, and other problems like scabies, dental caries, pediculosis may occur due to the poverty. Okay, so at the end of this topic, we can say that social medicine is equal to health for all. Thank you. Thank you so much for listening. I hope all of you are get clear idea about what is sociology and health.